extreme pleasure to serve as a moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know about. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all of the projects and work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. I see that people are continuing to join our webinar, so let's give them another few seconds and then we'll get started. This webinar is really all about getting answers to the questions that are on your mind. So before getting underway, I want to review how you can submit your questions. If you aren't familiar with how GoToMeeting works, you had a choice of joining today's webinar through your personal computer or your phone. If you join the webinar using your personal computer, your mic and speakers, you'll have the ability to submit comments and questions through the chat box that you should see on the right-hand side of your screen. You'll also see a hand icon that you can click to raise your hand and submit a question. As I chat with our experts, please feel free to submit your questions as they come to mind right into that chat box. We'll be sure to take time to address as many of your questions as we can. Now, I know many of you might have some very specific questions related to your own situation. Because our time is limited, we're going to be focusing on the questions that can pertain to everyone. Following the webinar, the questions that we're not able to get to will be addressed in the Society's FAQ section of their website, and you can always contact an MS Navigator to receive personalized attention to your particular question. And you'll find contact information for the MS Navigators on the Society's website. Obviously, I can't make this webinar happen all by myself. There are lots of amazing people working behind the scenes, and one of them is Julie Field. And Julie is going to help me today by pulling together your questions in the background while I'm busy talking. We may even get Julie to read some of your questions herself. I should also mention that due to the large number of participants we have today, everyone has been placed in listen-only mode. And if you're interested in reviewing today's discussion with our experts, this webinar is being recorded and it'll be available on the Society's website for reference. Today's Ask an MS Expert webinar kicks off a series of virtual opportunities the Society is committed to offering. Hearing your questions and listening to what's on your mind is going to help shape future Ask an MS Expert programs, so I hope you're ready to participate. Our objective today, and our objective in all of the Ask an MS Expert programs, is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind, the topics that really impact people affected by MS. It shouldn't come as any surprise that this week, the topic is COVID-19. In a matter of a few short weeks, the coronavirus has commanded the world's attention and managed to reset everyone's priorities. I've featured information about MS and COVID-19 in my podcast episodes over the past 2 weeks, and each of those episodes has already become the most listened to episodes of Real Talk MS in the past 2.5 years. But I have to say that for a subject that's really taken over the news, many of us still feel as though we've been left with unanswered questions or contradictory information. And that's especially true if you happen to be someone living with a pre-existing medical condition that might place you in that higher risk category. So today, I'm hoping our experts provide us with the answers to some of those questions. We're going to talk with our experts about what the risk of getting COVID-19 is for someone living with MS. We'll talk about what sort of complications someone living with MS might face from the virus. We'll get some specific advice about disease-modifying therapies in COVID-19, and we'll talk about how to manage the stress and uncertainty that so many people are feeling today. And we'll provide you with the key resources you should know about so that you can stay connected with credible, reliable information about MS and COVID-19. Now, before we dive in, I'd like to acknowledge that these are new and rapidly evolving times, so we do have a disclaimer to review. COVID-19 is a new coronavirus, and there are currently no published data available about the virus and MS. The information and recommendations presented in this program are based upon the professional opinions of MS experts and the evidence currently available about MS, infections, and disease-modifying therapies. This is a rapidly evolving situation, and we will update information as it becomes available. Please be sure to check the Society's website at nationalmssociety.org/COVID-19 to keep up with the most updated information on MS and COVID-19. So I think it's time we meet our experts. Dr. Erin Miller is the chief of the Society's National Medical Advisory Committee and is also the medical director of the Corrine Goldsmith Dickinson Center for Multiple Sclerosis and a professor of neurology at the Icahn School of Medicine at Mount Sinai. He also serves as vice chair for education in the Department of Neurology. Dr. Miller was the first chairman of the multiple sclerosis section of the American Academy of Neurology, and he's participated in numerous clinical trials of new treatments for multiple sclerosis. I should also mention that Dr. Miller doesn't have video capability today, so he's going to be joining us by audio. Kathy Costello is the Vice President of Healthcare Access for the National Multiple Sclerosis Society. In this role, she leads the Society's strategic initiative on access to quality healthcare, which focuses on self-advocacy, professional workforce development, healthcare professional relationships, and wellness. Kathy was a nurse practitioner and adjunct assistant professor at the Johns Hopkins MS Center located in Baltimore, Maryland, and has written and lectured extensively on MS and MS care. She received her BSN and MS from the University of Maryland. And Kathy, I'd like to start with you. I think the first thing that a lot of people want to know is what's the risk of people living with MS getting COVID-19 or having complications from the infection? So tell me, how does this virus spread?
Right, that's a great question. And thanks very much, John, and thanks to everyone who's joining us today for this really important information. So COVID-19 is a coronavirus. It's a type of virus where there's 7 different types actually of coronaviruses that can infect people. And they vary in the severity of illness that they can cause. This particular virus seems to be spread by what we call droplets, so that when we cough or sneeze, there's droplets that are expelled, and they can be contaminated with the virus if one actually has it. Those droplets can get on surfaces, they can easily get on our hands, and then they can be also spread easily. That's why all the precautions are out there and the things that we read from the CDC to help prevent the spread of this condition. Staying 6 feet away from someone to prevent that droplet transmission, washing hands frequently, cleaning surfaces, including our cell phones, for instance, helps to reduce that droplet contamination that can get on our hands and can reduce the spread of this virus. In terms of people who have MS, the fact that someone has MS does not increase someone's risk for developing COVID-19. There is some theoretical risk that certain of the disease-modifying therapies may increase risk. That's honestly not 100% known at this time, because as you said earlier, we simply don't have the data to support that. Based on what we know, there may be an increased risk. But it's important to note that just having MS does not increase the risk for getting COVID-19. If people have other risk factors, for instance, older age, comorbid conditions such as heart conditions, lung conditions, diabetes, these people may have a worse course of disease or infection if they would happen to get COVID-19 infection.
Well, we've heard that some groups of people are at higher risk of getting COVID-19 or of getting a more serious case of COVID-19. Who's at the greatest risk of that becoming a more serious condition?
Right, exactly. And again, these are people, whether you have MS or not. MS is not part of this equation, but people that are over the age of 60 are at a greater risk for serious infection, meaning they can develop pneumonia from having COVID-19 infection, and that pneumonia can be very serious. The same goes for people who have heart conditions or lung conditions such as emphysema or COPD. The same for people who have diabetes. Those are the folks that are going to be at greatest risk for complications from COVID-19 infection. Those people who are truly immunosuppressed, that are unable to fight any infection, are going to be at greater risk. That does not necessarily include people who are on disease-modifying therapies. As I mentioned, some of the therapies may have an increased risk, but that is really uncertain at this time.
Is there anything that someone can do to lower their risk of getting COVID-19?
So I think that speaks to spread. And so I think it speaks to following closely those CDC guidelines of washing hands frequently with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer, cleaning surfaces, making sure your phone is also disinfected, keeping that social distance, meaning keeping about 6 feet away to prevent droplet transmission. And for those people who are at greater risk, making sure that you're really being vigilant to these precautions, and making sure that you're not engaging in activities where there's gatherings of 10 people or more. The more people, the greater the risk that someone is going to potentially have this infection and then has the opportunity to spread this infection. And for those people who are at greatest risk, they need to be more cautious and really making sure that they avoid those situations.
Dr. Miller, I'd like to ask you, already we've seen recommendations about disease-modifying therapies and COVID-19 coming from multiple individuals, groups, and organizations. And while everyone has attempted to provide clarity and sound guidance, differences in these recommendations have created a significant amount of confusion. I'm wondering, what does someone need to know when it comes to making decisions about their disease-modifying therapy in light of COVID-19?
Well, I think the fundamental reason why there's been confusion about recommendations is that we lack data. Nobody knows specifically how any of these disease-modifying therapies specifically impacts the risk of contracting COVID-19 or of how one's going to handle the virus once one is infected. I think it's important as a general rule to say that in hardly any instances is it wise for a patient to discontinue the disease-modifying therapy. These therapies have been initiated because a person is felt to be at significant risk of having increased disease activity if they're not taking the medication. Specifically, we believe that all of the older injectable drugs, Avonex, Rebif, Betaseron, Plegridy, Copaxone, and the generic equivalents, glatiramer acetate, are very safe for people with MS. Tysabri is felt to be highly safe for people with MS. We know a little bit less about the oral disease-modifying therapies, specifically Gilenya and the newer related medication Mayzent, as well as Aubagio and dimethyl fumarate. In clinical studies, those drugs tended to very slightly increase the risk of minor infections, but we don't have any specific reason to believe that they greatly impact how one is going to handle the COVID-19 virus. The cell-based therapies, Ocrevus, rituximab, Lemtrada, and perhaps Mavenclad, the one oral drug that we consider in this group. Those drugs also may slightly increase the risk, but actually there's some experimental data in rodents that suggests that even the absence of B and T cells, which are two different kinds of lymphocytes, may actually enable a mouse to handle certain viral infections better. So I say that just to highlight the fact that this is an area where we critically lack definitive information. There have been differences of recommendations about the timing and the continuation of some of these cell-based therapies. In my own view, in general, these therapies should be continued. In some instances, they may be safely delayed, but particularly with the B cell depleting therapies, if the B cells return, a patient may be at risk of recurrence of the MS activity. And the problem with getting the B cells checked regularly is that entails moving about in one's community, which is generally not recommended. So in my view, in general, even the cell-based cell depleting therapies should be continued in a patient already on them. But you need to talk with your MS provider.
I think that for a lot of people, managing their emotional wellness is the most challenging aspect of their day. Trying to navigate through the world with limited and evolving information can lead to a lot of worry and stress. Kathy, what are some specific steps that people can take to better manage their stress?
Well, thanks, John. This is really a very, very important topic. And just to let people know that, when we encounter these kinds of situations, while this one in particular is completely unprecedented and we're in uncharted waters, it's a remarkably stressful situation. And there's certain reactions that people are going to have that really are normal reactions. There is that sense of uncertainty. There's that sense of anxiety. And I think that that is something that all of us will experience. People with MS, though, may experience a little bit more of that. They're already experiencing a condition that's unpredictable and not knowing, is today going or is tomorrow going to be okay? Or even today when I wake up, is it going to be a good day or a bad day? Then if you add on top of that, this type of crisis, that level of anxiety, stress, uncertainty just increases. But I will say this, people with MS also, by and large, have learned how to cope with uncertainty and how to manage that. And they often have remarkable resilience. And I think one of the first things that people need to remember when dealing with this new crisis is that they're really pretty good at this. And they need to really tell themselves that and remind themselves of their own ability and their own resilience. But sometimes things can get away from us. So what are some tips that we should provide for people? The first is to be informed. So checking our website, checking the CDC, and by the way, we do link to the recommendations from the CDC, checking other good websites, the World Health Organization, for instance, the MS International Federation, Can Do MS. Asking an MS navigator is a great way of keeping updated. I would say that we wouldn't want to spend all of our days on CNN or Fox News or any other news outlet, because I got to tell you, about 15 minutes of that and my anxiety level is going up. So I think that we have to have a small dose of that kind of information. Keep to the information that really is well vetted, very fair balanced, and not really trying to create any more hype or any more anxiety that's already there. So I think that there are things that people can do in their own home. For instance, people have worries. Am I going to be able to get out to the grocery store? Am I going to be able to have my medication? Planning ahead for that, planning for a few days of groceries so that you don't have to run out to the store. Utilizing the resources that you have in family members or neighbors. I've self-isolated since being home from a trip, and my neighbors have been kind enough to do a lot of the shopping for me while I'm in isolation, and thank heavens for that. So for medications, trying to ensure that you have an adequate supply and contacting your medical provider if you have any worries about the supply of your medication. As we've been talking about, don't stop or change your dosing on your own. Make sure that you contact your healthcare provider for advice if those are worries for you. Isolation is tough, and it's going to increase someone's feeling of uncertainty, unease. And so how do we connect without being able to be in those typical social situations that we're used to? And I think we have to do a lot of things electronically. Last night or yesterday, my granddaughter turned 1 year old. And last night we had an electronic or a digital birthday party. And all of us were on either iPads or iPhones, and we were singing and trying to engage the best we could in a happy birthday celebration. And it was actually unique, interesting, but you know what? We all really felt connected in doing so. So I say using the technology that we have, including the telephone, Skype, FaceTime, and other types of platforms to make sure that we're still able to connect with people, because as humans, that is a very fundamental need that we have that we must attend to. Wellness activities. People exercise. Well, now I can't go out to the gym. There are some things that you can do at home. We have some exercises on our website now. We hope to be able to add some. There are also programs that people can use. They can get advice from their healthcare provider or their rehab professional. We want people to make sure they get adequate sleep and contact their family doctor if sleep is a problem for them. Activities such as art, journaling, binge watching TV shows that I haven't been able to see has been fun. Seeing some movies that I hadn't seen that everyone talks about has been a fun way to spend some time. I think that just making sure that we have a healthy diet will be important for people. So I think these are all ways, and different things are going to work for different people, but this is how we're going to be able to cope and get through this crisis. Use those resources, be informed, and then make sure that you're engaging and connecting with others through electronic means if necessary.
Dr. Miller, I'm wondering if you might have anything to add to what Kathy's had to say already about managing worry and stress.
So I think Kathy has given very, very wise words, especially with caution about surfing the web, where you get a lot of faulty information. This is unvetted information. Even before the COVID-19 pandemic, one of my counseling bits of advice to people with MS was avoid internetitis, stay off the internet, go to reliable websites like the National MS Society, which will provide excellent information. But be kind to everybody. This is a chance to reconnect. I've already personally had the good fortune to hear from several friends that I talk to all too infrequently. It's a chance to reach out by means that you don't otherwise do.
We've received some great follow-on questions, actually, that relate to things we've touched on already. I'd like to circle back with you, Dr. Miller. There are two categories of disease-modifying therapy. There are some drugs that are called immunomodulators and others immunosuppressants. Which drugs are in each of those categories, and is there a different risk involved in terms of contracting COVID-19 or seeing it escalate if you are diagnosed with it? Is the risk different between these two groups of drugs?
Well, personally, I'm not really very fond of those terms, immunomodulator and immunosuppressive agents, because I think they're imprecisely defined. And all the drugs that we use to treat people with MS as disease-modifying therapies impact the immune system in one way or another. What really is the critical question is biologically, how does a specific agent work, and what effect might that happen in handling a particular pathogen, be it a virus or some other type of bug. The way the terms tend to be used is we have tended to reserve the term immunosuppressive therapy for the cell-based therapies, ocrelizumab or Ocrevus, rituximab, Lemtrada or alemtuzumab, and the one new oral agent, Mavenclad or cladribine. And we've tended to use the terms immunomodulators for some of the oral drugs, Gilenya, the newer cousin of Gilenya, Mayzent, Aubagio or teriflunomide, and dimethyl fumarate or Tecfidera. The older drugs, the injectable drugs, the interferons, which may actually even have some benefit in helping us to fight viral infections. That's why they got their name interferon, because they interfere with viral replication. So that's Avonex, Betaseron, Rebif, Plegridy, and Extavia, as well as Copaxone, we feel are very, very safe in MS. Tysabri, a drug which does impact the movement of certain immune cells, is regarded as quite safe. The other oral drugs, there's very little known in terms of whether they actually have any increased risk. If they do, it's probably very subtle and very slight, and we certainly recommend that patients on those drugs continue those drugs. In particular, by the way, I might emphasize the fact that suddenly stopping Gilenya or suddenly stopping Tysabri poses the added risk of what we refer to as rebound activity. That is, the MS can come back much more aggressively than it would have just because a person is not taking a disease-modifying therapy. The drugs that have been called immunosuppressive, the cell depleting therapies of Ocrevus, rituximab, Lemtrada, and Mavenclad, there's more controversy about their administration and whether there should be delays in redosing.
Kathy, someone has indicated that they have a family member who's a healthcare provider and still goes to work. Should they be self-isolating from this family member to protect themselves?
That's a great question, and part of that worry that we talked about a little bit earlier. And if that person who is out and about and working in healthcare has symptoms, then home isolation is probably useful and appropriate. And those guidelines for what that actually means are available on the CDC website, and it's actually what to do if someone is sick. But if that person isn't sick, then that home isolation is probably not necessary. But on the other hand, all of those other precautionary actions that we mentioned earlier, hand washing, surface washing, those types of things are still very important. And they're important in general, but I think that actual isolation is not necessary unless someone is actually sick.
Kind of a follow-on to that. When someone gets to their infusion or medical appointment, what can they do to protect themselves that goes beyond just washing their hands?
Yeah, that's a great worry too. And I will say that the infusion centers often have procedures in place because they're well aware of the situation and the potential spread of COVID-19. And before we had COVID-19, there was always concern of spread of anything, the common cold, or even influenza, or other contagious conditions that have always existed. With this, it's a bit heightened. So there are going to be precautions that are going to be in place. For instance, those chairs that people sit in will be wiped down carefully. in between patients. There will be significant care taken with hand washing. There will be distance separating different people from each other that are getting infusions. These are all typical precautions that infusion centers are using. There is worry sometimes that people have to walk through the hospital in order to get to their infusion center. Then I think it's those precautions of social distancing, of keeping 6 feet away when possible, and making sure, again, for those other good practices of hand washing are the best ways to reduce this spread, and then that reduction in your ability to contract this infection.
Dr. Miller, someone who's joined us on the webinar is experiencing new symptoms they feel might be a relapse. Is it safe for them to use steroids?
As far as we know, it is safe to use steroids for an MS relapse. It is important for people with MS to realize that what steroids do is hasten the recovery from a relapse. They don't make you recover better or to a greater extent than you would have without the steroids. So one might be a little cautious about, well, whether one gives steroids. Nonetheless, we don't have any evidence that the use of steroids increase the likelihood that you're going to contract COVID-19 infection. And if you do indeed have the infection and you need steroids for an MS relapse, it's quite likely to be safe. Keep in mind that some of the most severely affected COVID-19 patients, those with acute respiratory distress syndrome from pneumonia, are actually given steroids because it helps to lessen the inflammatory response that's making these individuals very sick.
Let me also ask you this question, Dr. Miller. Many medical facilities are delaying procedures viewed as elective. Since MS infusions are routine, are they considered elective?
I don't consider MS infusions to be elective. They are a treatment. They're not an elective procedure in my mind. And as a general rule, I don't recommend delaying these infusions. The infusions are designed, for the most part, at least the anti-B cell therapies, Ocrevus and rituximab, are designed to get rid of B cells. And if the B cells return, a person is likely to be at risk for MS. Some people have advocated trying to follow the B cell counts because they don't always return by the time of the scheduled infusion. The problem with that is that, of course, entails a lot of movement around in the community to get your bloods tested. And so I personally, in general, have just recommended that my patients continue on their regular infusion schedule. This is an area of some controversy, however, and other providers may have a different viewpoint.
Thank you. Kathy, someone has posed a question saying, I'm a parent and my child is anxious and is seeking comfort and closeness from me. I want to comfort her, but also keep myself safe. What should I do?
I would say that it is fine to comfort your child, and this is a very important time to have that. I think that we're all practicing social distancing, and we're practicing reducing gatherings of 10 people or more, and our children are part of that as well. Most of our children are now home from school, and just because they're home from school doesn't mean that they are out in large gatherings either. And I think that this is an anxious time, and that ability to comfort each other and certainly comfort our children is very, very important.
Thank you for that. Dr. Miller, someone has posed this question. I thought having MS meant we have an overactive immune system. Shouldn't that mean we're more protected from the virus?
Well, I wish that I could say that that were the case. I think there's a little bit of a misconception about the use of the term overactive immune system. The immune system in MS is not working overtime in general. It's just that for reasons that we don't understand, the immune system of a person with MS is programmed so that it has the potential to attack that person's own nervous system, which people without MS or some other specific neurologic conditions generally lack. So it's not a general sense of increased immune function that would, in theory, protect the person.
Well, this seems like a follow-on to that question, Dr. Miller. Should I be using vitamins and supplements to boost my immune system?
In general, we have tried to steer MS patients away from things that boost their immune system. We don't, again, have any real data that tells us that that's a harmful practice, but we don't really know that those supplements might not in some way increase the potential for the specific autoimmune attack on the nervous system. So I generally, even in this current pandemic, would not recommend that people take those supplements. We really don't have any good scientific evidence that those things really protect us from infections.
Kathy, someone has asked, they say they work in an environment where they're exposed to a lot of people. Should they be staying home right now?
So I think it's important to follow whatever the businesses are doing in your municipality. Some of them are now closing their doors for a period of time and people are actually working from home. I think that when you work in an environment with a lot of people, when you're able to keep that social distancing, that's important. And again, that all the things that I keep repeating, but it's that hand washing and surface disinfectants and so forth are very important. If someone is able to alter where they're working to reduce their chances, that would be terrific. And a lot of, as I said, a lot of businesses, even a lot of municipalities are putting rules in place to limit how much interaction there are between people. So I would be very cognizant of those rules and regulations and guidelines, and then working with your employer if there's a particular reason. And what would that be? Are you at greater risk because of other comorbid conditions? Are you an older person and you're at greater risk for more severe infection? Again, not just because you have MS. Is there a reason that you've determined with your MS provider that given your medication and your particular individual factors put you at greater risk? Those are conditions where those situations for work may need to be altered and accommodated based upon those specific factors.
Dr. Miller, let me ask you, if someone is diagnosed with COVID-19, should they continue taking their disease-modifying therapy?
Again, as a general rule, in almost all instances, we feel that people who are on disease-modifying therapies for their MS should continue their medications. There may be some rare exceptions to that, but that requires a discussion with a knowledgeable MS healthcare provider. In my own view, one potential exception to that is a person with progressive MS who's elderly and has been on the B-cell depleting therapy, Ocrevus or perhaps rituximab. Given the fact that these drugs have had a relatively minimal effect on progression, and because these people generally do not have an active inflammatory process, it might be wise to either discontinue or to hold that B-cell therapy while we're going through this pandemic. Again, that's my personal view. Other healthcare providers may have a different opinion.
And Dr. Miller, again, another question for you. If a vaccine for COVID-19 is developed, can people with MS receive it?
So I wish we were going to have a vaccine around the corner, but clearly we're not. It's at least a year away. The experts say. In general, with regard to vaccines for people with MS, we recommend that they get that they are able to take non-live virus vaccines in almost all instances, particularly the flu vaccine, which we advise MS patients to get. It is highly likely that if a vaccine for the virus that causes COVID-19 is developed, it will be not a live virus vaccine, and hence it, like influenza vaccine, would probably be safe for people with MS. Of course, stay tuned for more developments, hopefully sooner rather than later.
Kathy, someone has submitted a question saying that a lot of this information is really useful. I don't always feel that I can communicate my questions easily to my doctor. Where can I find resources that is going to help me better communicate some of these important issues to my doctor?
It is very difficult sometimes to find the right words to actually clearly articulate what's going on and what's on our minds. And so I think that it's certainly a good time to call an MS navigator. This is certainly something to discuss. A navigator can help you formulate your ideas so that you can go back to your healthcare provider and state what your issue is. I think if the healthcare provider has a nurse or someone else in the office that you can start the conversation with, sometimes that person is easier to speak to, and you can get your thoughts out more clearly. I think, again, looking at the National MS Society website, there are some tips there that may be helpful in helping formulate your questions. Write things down ahead of time, particularly now when there are opportunities for virtual visits. Some things may be handled by telephone call. Sometimes questions can be asked over the electronic medical record. But thinking ahead of time about what it is that you're needing, what you're wanting to ask, and then writing it down so that it's all there and clear for you. Having someone help you, talking it over with a family member, and as I mentioned, an MS navigator, just to hear what's on your mind and to formulate that question clearly can help you, whether it's going through the COVID-19 crisis or just in general when you're meeting with your healthcare provider. Time is so precious in these visits. And before you know it, you don't seem that you just sat down and off you go and the visit's over. So being able to succinctly state what's on your mind is important no matter what, whether it's around the COVID-19 crisis or any healthcare issue.
Another question for you, Kathy. Should I be wearing a mask if I need to go out in public and I'm living with MS?
That's a terrific question. And I spend an inordinate amount of time in airports, which is why I'm self-isolating now. And many people were out there wearing masks. And I can tell you for a fact that healthy people should not be wearing masks. You're not preventing anything. When people are sick and they have a lot of respiratory secretions, particularly right now, they will be wearing masks and they should be wearing a mask. There are instances where healthcare providers who are evaluating people with potential COVID-19 are wearing either a mask or even a face shield to prevent droplet contamination. But for people who are healthy, whether you have MS or not, wearing a mask is not necessary. And to be perfectly honest, it's using precious resources that are honestly needed elsewhere.
Dr. Miller, someone wants to know, what are the survival chances for someone with MS who's diagnosed with COVID-19?
Well, John, before I tackle that question, I'd like to just add something to what Kathy said about masks. There is a lot of widespread use of masks and different messaging that's been given about it. The one thing to know is that these surgical type masks, they are a one-time use mask. If anybody's going to use it, the risk of these masks is is people put them on in the hopes of protecting themselves from a droplet or something that's, well, even a micro droplet. And then if the mask does its job and gets contaminated, you're going to potentially infect yourself by handling that mask. So if you do need to insist on wearing one of those masks, get rid of it in a safe place. So let's go back to, I think your question was about what are the serious morbidity, mortality rates, and are they increased for a person with MS? Well, the good news is that for the most part, COVID-19 infection in everybody is a benign and self-limited infection. So the vast majority of people who get infected with the virus are going to have a mild flu-like illness, and they're going to get better in a few days to a week. We don't have any evidence that an MS person who is otherwise in good health is likely to have an increased risk of infection, of serious consequences from their infection. Of course, if the person with MS happens to have chronic lung disease or diabetes or a heart condition or is very elderly, then the risks are going to be greater. And we've talked at length about whether or not the risks are any greater for people taking these various disease-modifying therapies. And for the most part, we think that if there is any increase in the risk of the morbidity, it's quite small.
Dr. Miller, if someone gets COVID-19, can they get it again?
Probably not. It is likely that the infection with this particular coronavirus, once it's over, a person will have immunity to the virus. Whether that immunity, and that immunity may potentially be lifelong to that particular virus. Of course, a lot of viruses mutate over years, which is why the influenza vaccine has to be given every year, because there are different strains. But it's likely that once you've had an infection this go round, that you will probably be protected from a subsequent infection with this exact same virus.
Kathy, someone has asked that their neurologist, in talking to them, told them that it would be helpful to eat healthy. What does that mean?
I think Kathy's on mute. Okay.
We're not hearing you. There you go.
There we go. Sorry about that. So thanks for that question. It's one of my favorite topics to discuss. And so eating healthy is really not complicated, but it can be challenging. And that doesn't seem to make complete sense together. There is no diet that we know of for MS. However, we do know that eating a healthy diet can be very helpful for people in preventing some of those comorbidities that we've talked about. So what does that mean? Eating fresh fruits and vegetables whenever possible. Having lean sources of protein, which are our meat, our fish, our poultry. Making sure that we have plenty of water, so non-caffeinated, non-sugary beverages. Making sure that there's adequate fiber in the system. Are ways that we believe are healthy eating. Avoiding some of those comfort foods. You know, in the midst of this crisis, when you're really feeling stressed, boy, does it look enticing to have a pint of Haagen-Dazs. But I got to tell you, having that kind of sugary food is probably not the best thing, nor are those overly salty snacks. These are the things that honestly make us feel sluggish. They can honestly make us feel more fatigued. They drain our energy. When we eat those healthy foods that are nutrient-dense foods, the things that have lots of vitamins and minerals, those are the things that energize us. They help our systems work properly. All the pipes are working as they should. They actually help us sleep better. And we need sleep to be resilient. So these are the ways that I would suggest that people eat healthy. Now, it's hard sometimes right now to go to the grocery store and find what you want, because let me tell you, the people that are out there are cleaning out the shelves. Fortunately, toilet paper is not part of healthy eating, because you can't find that anywhere, I can just tell you. But sometimes you can find fresh fruits and vegetables. And I would say when you see them, and you're able to purchase them, I would go ahead and do that. If you can't find those that are fresh, frozen is the next best thing because they haven't been processed. So we want to stay away from those processed foods. I often say to people, if it comes in a bag, a box, or a can, it's likely to be processed. And if it says it's healthy, it may not be, because likely it's only saying that because it comes in a bag, a box, or a can. So we have to try and limit those things. And cost is an issue, and we have to be mindful of that. But trying very hard to limit those foods that are considered less healthy is important. And when we can, increasing those foods that I've mentioned that we consider healthy are important.
Dr. Miller, someone wants to know whether getting COVID-19 can actually trigger an MS relapse.
Well, I would say that we don't have any specific information about COVID-19. However, viral infections in general are regarded as a potential trigger for an MS relapse. That doesn't mean that if you get COVID-19, you're going to have a relapse. In all probability, you're not going to have a relapse. But when all is said and done, if we are able to get the data, I wouldn't be surprised if we saw a slight uptick in the rate of MS relapses. The bottom line, however, really is you have to do absolutely everything you can to protect yourself from getting an infection with the COVID-19 virus. And it's not really relevant as to whether or not it's going to increase the risk of relapses. You want to try not to get the infection.
Julie, I'm wondering what else are you seeing come through?
Thanks, John. We're getting lots of questions. We've covered many of them. One of them is that a lot of people are hearing about ibuprofen use, and I'm not sure if you asked that yet, John, but there's some news reports that ibuprofen can make symptoms of the COVID virus, if you do have it, worse. Wondering if there are, if Kathy or Dr. Miller could give some thoughts on that.
That's a great question. Dr. Miller, what have you heard about ibuprofen and COVID-19?
Yeah, well, there has been some chatter on the internet about that. The FDA just, I think today, issued a statement saying there really isn't any convincing evidence that avoiding ibuprofen is beneficial, or that conversely taking ibuprofen is harmful. But keep in mind that the main reason for using ibuprofen in the context of a coronavirus infection would be to lower the fever. So there are other ways to lower the fever, specifically acetaminophen in appropriately used amounts is probably just as effective in lowering the fever. So if you have any concerns, you can use that instead, but there really is not any really good evidence to say that it's bad to use ibuprofen.
Julie, what else are you seeing?
Lots of questions coming in about different DMTs people are hearing about in the news being studied to actually be treatments or potential treatments for the COVID-19 virus. Wondering what your thoughts are on that, Dr. Miller.
Well, the only one that I've seen at all raises the question was gelenium possibly being tried in China. As I already said earlier, it's potentially possible that interferons could be beneficial. The bottom line really is that at the moment, I don't think it's a good idea to try to get prescribed one of these medicines for the sake of trying to prevent coronavirus. If you need it for your MS, of course, that's fine and good.
Well, one of the things we wanted to make sure we did during our webinar is connect you with the key resources that you can count on for reliable information about COVID-19 and MS. Kathy, I'm wondering if you could take us through some of the resources people can be checking in on regularly.
Absolutely, and thanks so much for this. So the National MS Society, our organization, will update information nearly daily. In fact, we've added information from the FDA about ibuprofen, as Dr. Miller mentioned, that there is no evidence right now, but they are actively investigating this. So we have that information there. When there are any treatments or trials or vaccines, as that comes along over time, we will definitely be mentioning that. So please check the National MS Society's website. Right on the home page, you will find information on COVID-19. Our MS navigators are very knowledgeable sources of information, resources, and support. Please contact them. The information is on the screen. The 1-800 number, if you're listening by phone, is 1-800-344-4867. Please call an MS navigator. You can access them by email and also chat feature on our website. Can Do MS is a great source and a partner with us, and they have terrific information, and they will also be having information in the form of a webinar for people living with MS. The CDC, I've mentioned it a bunch of times on our call today, but honestly, they have terrific information. Obviously, as conditions change, they have been changing that information to meet whatever the new information or the new data happen to be in terms of precautions, action items, home isolation, the things that we've mentioned. They have terrific information, very clear on their website. And let's not forget Real Talk MS. John, your podcast is fabulous. I certainly make it part of my listening all the time. And right now you are really covering COVID-19 and having experts on your podcast that are really helping people. One that I particularly like was the one with Dr. Hughes from Johns Hopkins around anxiety and uncertainty in this time that we're going through now, and what kinds of things people can do to help reduce their anxiety and really just make it through this in the best way possible. So I encourage people to use these resources. And again, I mentioned this earlier, but minimize the news stories, the news shows. News shows to me are CNN, MSN, Fox, because watching those talking heads over and over and over again, it really increases anxiety. If you feel you must, minimize it, maybe once every day or so. But these resources that I've mentioned to you, these are the ones that you really ought to stick with, because this is where we are updating the most evidence-based information possible.
Well, thanks, Kathy, and thanks for mentioning Real Talk MS. I have to say that an awful lot of people seem to agree with you about the value of Dr. Abby Hughes' participation in the podcast. That it has been, after 133 episodes of Real Talk MS, that is the single most downloaded episode already. Thank you, Dr. Aaron Miller and Kathy Costello, for sharing your knowledge and for everyone's engagement in today's webinar. Please remember that a recording of this webinar is going to be made available on the Society's website. And I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. Completing the survey makes a real difference. The information you provide us is going to help continually improve, and it's going to help shape future webinars. The survey only takes 1 minute and makes a huge difference. So please take a minute to fill it out. On behalf of Dr. Aaron Miller, Kathy Costello, and the National MS Society, I want to thank you once again for joining us. Stay safe and make healthy choices.